Everything from how to reduce symptoms to treatment options that can help with Dr. Samson Davis. Welcome back. Doc, you're back.
Yes. Great to be back.
Why is it we say the word allergies and immediately my nose starts itching? Is that psychosomatic or what?
I think it's contagion.
When exactly does the springtime allergy season start?
So we're in the heart of it now.
Okay.
Right? So it starts as early as February.
I started sneezing in February one day.
Yes.
And I couldn't stop.
That's the beginning sign.
Okay.
And it goes as long as into the summer. So with climate change, though, we're seeing allergy season kick into full effect earlier in the year now.
All right, what are some of the triggers? Obviously pollen, yeah?
Yeah, pollen. So pollen is made by grass, weeds, trees, right? So pollen, as you start to see the grass grow and you see the trees budding, then you know the allergy season is coming, so you have to prepare. And it depends, like certain ages, like certain stages of life, you can have severe allergy seasons, and certain ages of life, it could get better for you.
Yeah, I go, sometimes I don't have any, for a couple of seasons I have nothing, and then it kicks in for a season.
Yes,
it's
it does.
Interesting like that.
What do you do for seasonal allergies? Like how do we know if it's a cold or allergies?
Right.
You know, like in the office here, everybody they sneeze and then they're like, it's my allergies, because they know that we're all panicky about somebody spreading a germ.
Yes, especially coming off the heels of COVID, we worry about that as well. But as far as the, it's allergies because of the symptoms you get. So you get the watery, itchy eyes. I usually start from the head and work my way down. So the watery, itchy eyes, you get the dark circles, the congestion, you get the scratchy, itchy throats, the cough. You just feel miserable. Now, viral illnesses like colds and something that's contagious that you can pass usually lasts a shorter period of time. As you know, allergy season waxes and wanes. It can go on for weeks and months at a time.
Do allergies get worse with age?
It depends. It depends. It depends on your immune system. So some people actually improve and they were bothered by pollen.
Yeah. They get used to it.
And they get used to it. Then depending on your immune system, it's a coin toss. So some people actually pick up things and all of a sudden dog dander or mold causes their allergies to be triggered.
We used to live in Soho where none of us suffered from allergies.
Because there's no trees down
there.
there.
Then we moved to the Upper East Side, and it truly, like all of us, suddenly discovered allergies.
The park is right there.
Yeah.
And you can see the pollen-decorated cars. You know
exactly.
when it's happening.
Yeah.
So what are the fastest ways to treat seasonal allergies?
So I like, the one thought is to remove yourself from the exposure. But with spring and summer, who doesn't want to be outdoors?
Right.
Come
of
on.
course.
And then with your kids playing, every activity that you have to be out there. So oral antihistamines is key. You want to start with that. You can also use decongestants as well. There's nasal sprays. You got decongestant nasal sprays. You got steroid nasal sprays. For severe cases, you want to carry an EpiPen, especially for your young little ones. You want to make sure you have EpiPen. And you could take allergy shots as well.
Allergy shots. What about just like, I find if I go for a nice long walk in Central Park, I come back and I shower just because I get all of the pollen that may have gathered on me off of me.
Very key, very important. So if you're outdoors and you're exposed to the pollen, you want to decrease that allergen. So removing your clothes, washing your clothes right away, maybe taking your outfit or whatever it is, having certain clothes that you wear when you go to the park, and certain ones that you keep away so you can change.
Okay, so let's specifically talk about what you recommend.
Yeah, like nasal sprays. Talk about that.
So there's a few. So there's one called cromolyn sodium. So what is that? It's a big, long medical name. It's a mast cell stabilizer. So what does that mean? It prevents the body from reacting to the allergen.
Okay.
So that's the first one I like. Then there's a decongestant. So once your body has reacted, say if you haven't had your hands on the cromolyn and your body has reacted, you can take a decongestant to kind of decrease some of that inflammation that's there. And you can also take a nasal steroid to decrease the inflammatory process.
I never understand nasal sprays because they tell you to like squeeze it in, but then don't sniff.
Yeah.
But then you're just sitting there
and it's dripping.
with it dripping out of your nose. Is it really important to not sniff?
Well, I would say I don't think it is, but at the same time, I do follow what the instructions say.
Yeah. What about over-the-counter stuff like Claritin, Zyrtec, and Benadryl?
So I like Claritin, I like Zyrtec, I like Benadryl. The Claritin, Zyrtec is like your second generation, so it's the more kind of newer type of medications. Allegra is one of them as well, but they don't make you sleepy, whereas the first generation, Benadryl makes you sleepy.
How about air filters in the house?
I like air filters because it decreases that airborne allergen from sort of circulating in the air. It's not 100% 100% foolproof, like as far as like treatment plan, but it limit the sort of exposure to allergen. I find the best treatment is just a combination of every little thing, and what works for you will not work for you.
Right. I heard drinking liquids.
Yeah.
You recommend drinking liquids?
I love liquids.
Any liquids?
No, not any.
Rosé?
Yeah, I was about to say the non-alcoholic rosé, right?
All right.
So water, juices, non-alcoholic beverages is very important, and also your warm beverages, broth, tea, soup, and then steam. Some people, if you go into the bathroom, you'll find that the steam helps to open up those nasal passages for you.
Just unloading the dishwasher.
Yes.
Like the steam from that will really give you a
That's the reason why I do the dishes.
Yeah, that's that way.
So once you have an allergic reaction, how many days, how long does it usually take to go away?
So the allergic reaction depends. If it's a severe one, you obviously will go to the hospital. But if you're monitoring, that's why like sort of prevention is key. So if you know your son or daughter or you yourself are susceptible, you start taking your medications early so you can prevent that kind of reaction.
So you don't wait for it to like become a full-blown allergy attack. You're like, high pollen count today, let's take the
Watch the weather report
so
you won't be behind the situation.
Yep.
Thank you, Dr. Davis.
Yes,
Always great to have you. For more information like this, visit our website. Coming up next, Grace Potter performs. Stick around.